Hey, Dr. Dessa.
Hi, Eric, right?
Yeah, how's it going?
Good.
Novartis.
Novartis, yes, of course. Come, sit down.
It's great to see you again. How's everything going?
Oh, it's good. Busy day, but as usual.
Busy's a good thing. That's great. Seeing patients. I know I've only been out here a couple times, but I wanted to ask you, you mentioned last time you were treating most of your eczema patients. You were treating them with corticosteroids. And I wanted to see if you could wave a magic wand over the treatment. What would you change about the way corticosteroids work?
Well, you know, it seems like I have eczema patients coming in every week, Eric, and my dermatology practice is so busy these days. I guess I wish there was a treatment that would help them manage eczema a little bit more independently.
Yeah, and a lot of your colleagues have said that to me as well, and most of them are using corticosteroids.
Yes.
What if I could present to you a medication that enables your patients to be empowered to treat their own eczema proactively versus reactively when the flares come up?
I'm interested. Tell me some more.
Okay, well, we have a product called Dermatopic, and the way Dermatopic works is patients apply it at the first sign of itch, and this clinical data here shows that in doing so, 70% of those flares are prevented from becoming serious.
Really? 70%? That's impressive clinical data.
Yeah.
But tell me, how safe is it if patients are self-diagnosing?
Well, you know, that's a great question, but instead of corticosteroids, this works in a different way. It has a different mechanism of action. So unlike steroids, where you're going to see some of that cracked skin or some of the thinning, what you'll see from this is you'll see a product that selectively targets the flare cells, while being gentle on the other surrounding areas and not causing any tissue damage or any problems from overuse. So they can even use it on sensitive areas of the body, like the face or the neck. It really works out well for them. It's a gentle, empowering lotion.
Okay, interesting. Oh, well, you know, Eric, I've known you for a long time, and I'm going to be honest with you. Corticosteroids is something I'm very comfortable with using. I've been using it the last 15, 20 years in my practice. So, are you asking me to move all those patients who are already on corticosteroids over to this Dermatopic?
Absolutely not. Dermatopic is not for every type of flare-up. It's not even for every type of patient, but where it will really fit in well in your practice is for managing those patients that you spoke of earlier, the ones that are frequently coming in. They've got the mild to moderate eczema. You know, you probably know some of them quite well.
I can list a few in my head right now.
Yeah, because you're seeing them so frequently. Well, what this will do is it'll enable them to proactively manage and control their eczema, which will allow them to really do what they want to do, which is forget about even having the condition.
That's true. Okay.
Let me ask you this. If you could select 5 of those names that popped into your head and try using Dermatopic on them, I'll stop back in a month and we can discuss what the results are. I think you'll be very pleased.
That's true. You know, I'm willing to try it, to give it a try. So, sounds good to me.
Sounds great.
Yeah,
thanks Dr. Dessa. Appreciate it.
Bye-bye. Come in.
Hi, Dr. Dessa. How are you doing?
How are you doing, my friend?
Fine,
Sit
thank you.
down.
Sorry.
How are you feeling today?
I just came to bother you a little bit. You remember that cream you gave me? The one about the blue tube?
The blue tube. Ah, the corticosteroid.
Yeah,
for
for my
eczema.
flare-ups.
Yes.
You know, I put it on every time I feel the flare-up coming up, and my hands have been cracking, and flares are coming up more often. And you know what? This one even was bleeding last week.
Really? Oh no. Well, when you're using this cream?
Every single time I feel a flare-up coming,
Okay.
it starts itching, and I put the cream right on until the redness is gone. You know how often this is. It's getting worse and worse.
So it's happening frequently, you're using the cream. Tell you what, Javier, I have something new I'd like you to try. Now this is a cream that's very special. In fact, let me see here. Look at your chart. Yes. This is a cream that you can put on right when you feel that itch coming on. And you can use it until the redness is gone. So I'm going to give you a tube, try it out, and tell me how you feel, okay?
Okay, but what about the bleeding? I mean, I'm concerned.
I know you're concerned about the bleeding, but this medication is different. It works in a different way. It actually only targets the cells that are affected by the eczema. So you don't have to worry so much about the bleeding and those negative side effects like that. However, you know, one good thing about this medicine as well is that you can also use it on sensitive areas like your face and neck. So
Wow.
I know you were looking for something that you could use on your face.
Yeah, I've always been a little concerned when it comes to my face and neck.
Yeah, well, tell you what, give this a try. You know, use it for the next month or so. Book an appointment with my secretary, and come back in a month, and we'll see how you're doing.
Well, if this is as good as it sounds, I might not be seeing you that often, doctor. Sounds great.
We'll see.
Nice meeting you. Thank you.
Bye-bye.
Bye.